Yes, this is Kanchan Deshpande.
I think
So,
Dr. Maya has to unmute herself. Yeah.
so am I audible now?
Yes, you are audible,
Yes.
Kanchan. Go ahead. Yeah.
Okay. So, doctor, as you already mentioned in your hereditary site, right, that if a person has vitiligo, then there may be chances that the child also gets vitiligo. So there is this myth that I have been hearing since my childhood. Now I have vitiligo since the age of 7. Right now I am 35. So that the vitiligo goes into alternate generation. So if I have a vitiligo, then my grandchildren may get it. So is that true?
Mukta, you will take it or I'll take it?
Sir, please go ahead, sir.
See, this is a common question. These are questions which people phone us and ask at least 2 calls a day we get. As you're saying, this myth of skipped generations is there because there are 2 types of inheritances. One is called as autosomal and one is called as autosomal recessive. So when there are some diseases which are autosomal recessive, there you can have that disease in skipped generations. But this is not true at all with vitiligo. Means if the grandmother has vitiligo, it's not that the grandchild or the grandson will have vitiligo. There is no scientific basis for this. So in the hereditary, people have found that when you study a patient of vitiligo and a large family tree of that patient, you will find that in the whole big family, you will find some more patients of vitiligo than in normal families of patients. As it is the incidence, how many people out of 100 have vitiligo, do you know? Maybe if some books quote that at least 3 to 5 patients, 1 to 2 patients of 100 have vitiligo. 1 to 3% is the prevalence. So it runs in, or you can have many family members with vitiligo, but there is no mathematical equation as to how it is transmitted.
Absolutely.
Okay. So that's a good thing to know actually, because we have been hearing so many things even in today's generations. Also, I had some one other question about the treatment. Now, I have been also taking phototherapy treatment, but there are some laser treatments also available. So, what is the difference exactly, and how much? Which one prefer? Either go for laser or the phototherapy?
Okay. Sir, can I take this question?
Yes, you take it.
Okay. So, excimer laser is basically a targeted phototherapy. More than laser, accurately, we can call it a phototherapy lamp. So, what we take in the phototherapy chamber, this excimer lamp has a 308 nanometer wavelength, delivering targeted light only to small patches of skin, about say a 5 by 5 area skin. So it is recommended for smaller patches and maybe recalcitrant patches or patches which are not responding to regular UVB therapy.
Okay. So is there any history or the experiences from patients that which one is giving the faster results, the phototherapy or the laser?
So targeted phototherapy does give faster results because it is more focused, but we prefer it for smaller patches of vitiligo because it is a small targeted area. Okay.
Okay.
But even the phototherapy chamber itself will give equally good results for larger body surface area.
Okay. Okay.
Add something to it.
Sir, anything you want to add, please?
No, you're right, Mukta. She has told you
Yes.
the right, correct thing. But one more factor which will affect the response to the patches is
So the site, site of it. Yes. Yes.
So, yes, you can go ahead.
Yes. So it also depends on the site of the lesion. If it is on hairy parts of the body, the response will be better with excimer laser or with UVB chamber. If it is on non-hairy areas like the tips of the hands or legs, feet, then the response will be delayed or not satisfactory.
Thank you. And now, can I ask one more question, please?
Yes.
Yes.
Actually, now since we talked about the vitiligo being autoimmune disease, so and now since we are living in now Corona age, so is there any special care that the vitiligo patient should take because Corona is mostly affecting the people with less immunity, other than the regular the precautions that we are taking for Corona?
So would you like to take that, please?
No. See, there is no special precaution because vitiligo does not mean that a person has less immunity. It just means that probably his immunity is not on the right track. He has as good immunity as the most healthiest person on earth. He doesn't have less immunity at all. Only thing what one can take care is that many a times there are certain medications which are given to arrest the spread of vitiligo, like some steroid medicines which are given under supervision, or some immunosuppressive medicines like one is called as Azoran tablet, which can for the time being only suppress the body's immunity, and that's how stop the spread of vitiligo. So if the patient is on those type of medicines, then he should inform the doctor, and the doctor will alter the medicines accordingly, and he will stop the medicines which are depressing his immunity.
Very well explained, sir. Very well explained, sir. Thank you.
Okay, okay. Yeah, that was it. Thank you so much, Dr. Mukta and Dr. Sunil.